Good afternoon, everyone. Welcome to today's webinar on long-term care Medicaid. You might notice that you cannot see others in the webinar. We have a new format for our webinar today. If you have questions, I'm asking you to put those into the Q&A box, not into the chat box today, please. So use Q&A box for questions. If you want to do something else, like introduce yourself or something, feel free to use the chat box for that. My name is Sharon Rich. I'm the Senior Trust Advisor for Aged Trust, where we manage special needs trust for seniors and persons with disabilities who need to qualify for Medicaid and have too much money. Today's program is approved for continuing ed credits for professional guardians and attorneys. You will receive an email from Kate at trustaged.org within the next week that will have a certificate of attendance for you and a copy of the presentation and link to the recorded presentation. All of our webinars are posted to our trustaged.org website for your viewing afterwards. And we have a large audience today, so please do put your questions into the Q&A, and we will leave time at the end to answer them. I'm very excited to introduce our speaker today. Tracy O'Neill Spencer is our benefits specialist here at Aged. She has extensive experience with assisting seniors and disabled individuals with applying for Medicaid and other government benefits, as well as advocating for our clients to resolve facility and medical billing issues. Prior to coming to work at Aged, Tracy worked as a professional guardian, where she helped clients with benefit enrollments, Medicare, Medicaid, Social Security, VA, and helped to resolve medical billing issues there also. Tracy also stepped up to become a family guardian for a close family member, helping to care for their needs and managing a QIT trust for Medicaid eligibility for a nursing home. With industry experience since 2012, Tracy has recently transitioned into public speaking to help share her wealth of knowledge with the community. Her educational background includes a Bachelor's of Art from Toledo, Ohio, and along with a Certificate of Gerontology from UCF, Allegra Learning Solutions. So with that, I would like to turn it over to Tracy, and we're going to start the presentation now.
Goodness. Sorry. Sharon, did you want to talk a little bit about Aged?
Sure, I'll just mention, because this program today is so focused on Medicaid, and everything we do here at Aged is related to helping people to qualify for Medicaid. We are a nonprofit 501c3 with a mission to support the advocacy and guardianship needs of the elderly and the disabled whose financial need is inadequate to pay for services. We are located in Central Florida, but we manage special needs trusts throughout the entire state of Florida, all different types of special needs trust. And we have no minimums or maximums. So please use us as a resource, and we like to help. So Tracy, you can take it from here.
Hey, good morning, everyone. Today, we're just going to go through the long-term care benefits available through Medicaid. And we're going to talk about long-term care, which includes ICP and Home Community-Based Services, HCBS waiver. Talk a little bit about the wait list and how Medicaid is delivered or received in Florida. which is through the statewide Medicaid Managed Care program, and that includes the MMA plans, which is Managed Medical Assistance Plans, the long-term care plans, the LTC, and dental plans. Go over what the NOCAs look like, or the notices of case action, and then answer some questions. So to get started, long-term care programs through Medicaid are hospice, which is not just end-of-life care, that is comfort care as well for people that are terminally ill. ICP, which is nursing home Medicaid, and then HCBS waivers. And HCBS is not just the long-term care, it includes 4 different types of waivers, and that's familial dysautonomia, and that is a very specific waiver. iBudget, which is handled through APD, and I'm sure a lot of you are familiar with that. The model waiver, which is a smaller waiver, and then the SMMC LTC, which is the long-term care waiver, and that's what we're going to concentrate on today. So ICP is institutional care program. For that's long-term care in skilled nursing. You must meet the medical and financial criteria for ICP. But once that is met, then that is immediately available for someone that's in a nursing home. They must have a need for a nursing home level of care, and that can be physical limitations or a mental capacity issues as well. There is a patient responsibility to the nursing home, and that's the gross income less $160, which is the personal needs allowance. Available when they have ICP is a spousal allowance, and that is if one person is in a nursing home and one person is living in the community or an assisted living facility, then some of the institutionalized income can be diverted to the person that is in the community or in an ALF to help them pay their bills. With ICP, you're allowed to do what's called a UMED, and that is a deduction for unreimbursed medical expenses, like health plans, dental plans, premiums, hearing and vision supplies, therapy services, nursing facility bills prior to 3 months prior to them being in the nursing home. And with ICP, most, if not all, of their medication and supplies are paid for. Excuse me. So a tip for if you have someone that's in a nursing home, if they're moving from a skilled nursing into an ALF, it is possible for them to transition to that Home and Community-Based Services Waiver that will help them pay for the costs of living at the assisted living facility, but they have a limited amount of time to do that. They have 60 days to transition to HCBS, or they will lose the long-term care benefit, and they have to go on the wait list for HCBS waiver. And you need to contact the long-term care plan case manager if you're considering making a move from a skilled nursing facility to an ALF. And they should be able to help you make that transition and help you find a facility. And they can do the paperwork to change that from ICP to HCBS. Be sure to read the long-term care plan handbook for coverage details, and we'll talk about the long-term care plans a little bit later. And be sure to ask, if you're moving someone, be sure to ask them, the ALF, which long-term care plan they recommend or they take, because not all assisted living facilities take all of the long-term care plans. So Home and Community-Based Services Waiver, or technically SMMC LTC, is for individuals in their home, in the community, or in an assisted living facility. With HCBS, there's limited funding. That's why there's a wait list. And as with ICP, they must meet the nursing home level of care, which is inability to perform ADLs or IADLs. ADLs are things like getting around, eating, dressing, their personal hygiene. IADLs are things like financial management, medication management, and housework. They must be 65 plus, blind or disabled between 18 and 64. And with HCBS comes full Medicaid benefits, so the medical portion is covered. Residents that have HCBS waiver that are in an ALF are responsible for paying room and board at whatever facility they're at. And since there's a wait list, if they don't have medical coverage aside from maybe Medicare, then it's possible for them to qualify for medical Medicaid, other types of medical Medicaid, like QMB, while they're on the wait list. So the wait list is, like I said, that's a it's a separate pot of money from regular Medicaid. That's why there's a wait list. And there's a screening process for the wait list. You would need to call the local area agency on aging. And here in Orange and Seminole counties, that is Senior Resource Alliance. You request to be put on the wait list, and someone will call you and do a preliminary assessment. From that, you're given a priority score, and then you're put on the wait list. And currently, anything below a 5 is not released from the wait list. It has to be a 5 or above. And once that happens, you wait. So you're waiting for statewide funding, for funds to be released, and the Department of Elder Affairs pulls names from the wait list based on that priority score. So it's not how long you've been on the wait list. If there are people that have a higher score than you, that are sicker, then they are released from the wait list before. And if there's a significant change to the person's circumstances, if they go in the hospital, if they have a cognitive decline, then you can call the Area Agency on Aging and request a reassessment. So once they're released from the wait list, there is a Form 3008 that has to be filled out. And for, after that it's filled out, a CARES assessment has to be done. And then when they're released from the wait list, at the same time, in coordination with that 3008 being filled out, then they can apply for Medicaid through DCF. And important for you to know, there's a whole separate process for, in addition to applying for Medicaid, for financial approval through DCF. The process for the medical approval is that 3008 form, and I've got that on the screen at the top. That has to be filled out completely by the physician and signed and sent back to the Area Agency on Aging. It doesn't go to DCF, it doesn't go to anywhere else, it goes back to that Area Agency on Aging. And if it's completed correctly, they will take that, send it to the CARES office, and the CARES office will call the person, schedule an assessment, and then they complete a report. Once that report is done, that is entered in their computer, their shared system, and then the Area Agency on Aging will do a 2515 form, which is the form on the bottom, and that is sent over to DCF as part of the financial approval, the final piece for the financial approval. If you apply for HCBS waiver, and this has not been done, or the person has not been released from the wait list or transitioned, then HCBS will be denied. Then when you apply for Medicaid, after that 3008 form is issued, you apply for a Medicaid through DCF, and DCF just does the financial approval. You can apply online, by paper application, or go to one of the community partner sites. And I don't think there are a whole lot of community partner sites available now, with them closing a lot of offices. I recommend doing it online. It's a lot easier, and you can upload documents directly to DCF on the computer. So to apply for HCBS or ICP, you need income documents for all sources of income, and DCF goes by the gross income, and it's all sources, not just Social Security, which is what a lot of people think. You need the three most current months of bank statements or investment statements, annuities, brokerage, all of that stuff. Cash value for life insurance. And you may be able to designate up to $2,500 as a resource for burial. DCF allows that. Be careful if somebody has SSI, because the SSI limit is $1,500 towards a burial account. And that can cause, if you try to use DCF's standard, then that can cause the person with SSI to have their benefits reduced. You will need a copy of a burial contract if they have one, and it needs to have an irrevocable designation. If it doesn't, then the entire cost or value of that contract is part of their accountable assets. And DCF will send you a notice if they require any additional information. Say they do a financial check and they find bank accounts that were open that you're not aware of, they will let you know we need statements from this bank account. So once they're approved for ICP or long-term care waiver, you have to select a long-term care plan. And the long-term care plans are how Medicaid is handled in the state of Florida. That is through the statewide Medicaid Managed Care program that started about 2014. Services are provided through private companies contracted with Medicaid. So Medicaid doesn't pay providers directly. These companies like Humana or Aetna or Simply will pay the providers, and then Medicaid pays them based on whatever they've negotiated. Most people on Medicaid, and that's family Medicaid, waivers, ICP, will get their services handled through one of these plans, the statewide Medicaid Managed Care program. The program is composed of 3 different components. There's the long-term care, and it covers the services like paying the skilled nursing facility, or if they're in an ALF, it pays towards the assisted living facility, or if they're in the community, it pays towards the assistive services at home. And there's the Medicaid or Managed Medical Assistance Plan, the MMA plan, and then dental coverage as well. So those are the 3 parts of the Medicaid Managed Care program. All of the plans are area specific. So what we have here available in Seminole County may not be the plans that they have available down in Broward County. They're all required to have minimum coverage services. So it's not like one plan is going to offer A through Z or A through G and the other offers different. They all have to cover minimum services. Some of the plans have expanded benefits like over-the-counter medications available each month, chiropractic services, or acupuncture. They have specialty plans for people that have HIV and AIDS, serious mental illnesses, children with chronic conditions, or child welfare is for people that are children that are in the foster care system. And the specialty plans would offer more things for those particular conditions. So say mental illnesses, under a regular plan, they would just be able to get 30 pills for certain medications, whereas with their mental health condition, they need, 130 a month. Then those specialty plans allow for that. And I believe they automatically will put someone on the specialty plans if they know that they have those particular ill conditions. Long-term care, ICP, HCBS is covered by a comprehensive plan, which has the long-term care and the MMA plans together. And of course, the plans vary by region. And the map up there shows the new region designation that changed in January of this year. We went from, I believe, 11 regions down to 9, and they used to be 1 through 11. Now their regions are A, B, C, D, that type of thing. So the long-term care plan benefits, the standard benefits are things like adult companion care, caregiver training, homemaking, all of those assistive skills that someone would need to manage at home, or it pays for those things to be provided in skilled nursing setting or an assisted living setting. And in an assisted living facility, the long-term care plan pays between $1,000, and I think it's actually increased now to either $1,800 or $2,000 towards the facility in an assisted living facility setting. The patient is responsible for room and board, and a lot of people think that HCBS covers the entire cost of them living at the facility. It does not. The patient is still responsible for paying the room and board rate, and room and board rates vary by assisted living facility. It just depends on the facility and their contract, whatever they decide is their room and board rate, and the contract with the long-term care plan as far as what the specific plan pays that facility. The MMA plans, the managed medical assistance plans, have standard benefits, MMA benefits, and they cover the medical. So they would cover the doctor visits, x-rays, labs. Important to note that the MMA plan covers prescription drugs. So they don't have to have a separate Part D plan if they have ICP Medicaid or HCBS waiver and they have the full Medicaid. That MMA plan covers that. And how the LTC and MMA plans work when someone has Medicare. LTC plan is not really involved with the medical cost. But if they have that comprehensive plan, which is the LTC and the MMA plans together, then the MMA plan provides the medical coverage. So if they have Medicare, between the Medicare and the MMA plan, they have complete medical coverage. And that includes the prescription drugs. If they are on Medicare, then Medicare is the primary payer. If someone goes to the doctor, the hospital, and the MMA plan is a secondary payer. If they have a Medicare supplement, if someone goes into a nursing home and they had a Medicare supplement, Medicare is the primary, the Medicare supplement is the secondary, and the MMA plan is the tertiary payer. So just remember, Medicaid is always the payer of last resort. If they have a Medicare Advantage plan when they go into a skilled nursing facility, or they're on HCBS waiver, then the Medicare Advantage plan has to be a dual eligible Medicare Advantage plan. And now they're starting to run all the commercials because it's open enrollment time about DSNP plans. So that is the dual eligible plans that provide the Medicare coverage and the Medicaid coverage as well. If they don't have a dual eligible plan and they just have a regular Medicare Advantage plan, the regular Medicare Advantage plan does not cover the Medicaid portion. So they would need to switch to a dual eligible plan under whatever plan they've got. And you just need to contact the salesperson or the plan directly and tell them that they were approved for Medicaid and they need a dual eligible plan. And this is just another way to show that. Medical coverage with original Medicare and with the MMA plan. Medicare is the primary, MMA plan is the secondary. With the Medicare supplement, original Medicare is the primary, the supplement's the secondary, and the MMA plan is the third payer. And again, with the Medicare Advantage, regular Medicare Advantage plan, there's no Medicaid coverage, so it has to be a dual eligible plan. There is a dental plan benefit with the Medicaid Managed Care. They cover dental exams, dental x-rays, dentures, some extractions. Coverage for adults is kind of limited, and a lot of it requires prior approval. I know dental appointments are hard to get with the dental plan providers under Medicaid. And this is not to be confused with the dental plans that are offered if someone is in a skilled nursing facility. And I'll talk about that in just a minute. Okay, so the notices of case action. Once you've applied for ICP or a home and community-based services through DCF, they will issue a notice of case action if there's something, documents are needed for them to process the application. And this is what the NOCA looks like. The paragraph at the bottom just says, please submit the following documents. So they'll want the bank statements, whatever. They do an automatic financial check, and it's pulled by Social Security number. So anything the applicant's Social Security number is attached to, they will get a report on that, and things that you may not know about may show up on that. So make sure that you go through that and send them what they need. If you're uploading this to DCF or faxing documents to DCF, save the confirmations, because things that get faxed or uploaded sometimes end up in space. If you're faxing, and I redo this for everyone, we do an application for even online. We put their name and the case number on each page of the documents that we're sending. In case it ends up dropped into someone else's file, they should be able to find it, or at least they'll know doesn't belong in that file. These are two examples of notices of case action that have, the first one has a UMED, and this is a UMED for one of those nursing home dental plans. They now offer dental, vision, hearing, podiatry through those plans like ARIA, XL Health, Florida Preventive Solutions, and Sheridan. And those are more expensive plans, but that amount, if someone is in a skilled nursing facility, that amount can be deducted from what they owe to the facility, from their patient responsibility, and the patient responsibility is lowered to allow them to pay that for that dental plan. And the difference between these dental plans and the dental plan, a dental benefit that comes with the Medicaid, is that these dental plans have providers that come to the facility to do those services, to clip their toenails, to look at their feet, to do the hearing test. And they even come out there and fit them for dentures. Whatever they need, they go to the facility to do that. So with the other plan that comes with, or benefit that comes with the Medicaid, they have to go out to the providers. So it is worthwhile to have those sign up for those dental services at a nursing home, but make sure that the DCF has approved it and that whatever they're charging, their premium comes off of the patient responsibility before you start paying the dental plan premium. And if you notice on the notice of case action, they don't tell you what they're deducting. It's just you have to do the math yourself and see that it's not just the personal needs allowance that's deducted, that there's something else that's deducted, and you have to figure that out for yourself, unfortunately. The example on the bottom shows the spousal allowance. And again, that is being able to divert the income from someone that's in a nursing home to their spouse that's in the community or in an assisted living facility to help them pay their bills. That is definitely reflected on this notice of case action. For this particular case, 1472 is diverted to the spouse that's in the community, and that has lowered their patient responsibility to the facility to $691. The next example is an example, or both of them are examples of approvals for Home and Community-Based Services Waiver. And they look very different. It really just depends on who's processing the application as to what form or which notice they end up sending you. The first one says you get to keep this amount for your personal needs, and that is the amount for your personal needs and the room and board amount. And that may not be reflective of what the actual room and board rate is for that particular facility. But it really just depends on what the room and board rate is at that facility. The next one, the one on the bottom, shows what you're supposed to be allowed to keep for your the personal needs and what you were expected to pay the facility. But again, this is not necessarily reflective of what that specific ALF is charging as a room and board rate. And Florida is one of the few cities, I think there are 5 cities, that allow for what's called family supplementation to help pay for assisted living. So whatever the room and board rate is, if the person's income is not enough to cover the room and board rate, they allow the family to kick in and help pay for that assisted living facility. And so let's talk about a UMED. A UMED, I'm sure a lot of you have heard the term UMED. It stands for Uncovered Medical Expense Deduction. And that is a credit received for out-of-pocket medical expenses incurred when someone's eligible for coverage in a nursing home What it does is reduces the patient responsibility to the facility to allow that person to pay that expense. Medicaid doesn't actually pay those bills. It allows the person to pay those expenses with money that they would have paid to the skilled nursing facility. And again, that skilled nursing facility patient responsibility has been lowered to allow that. Allowable medical expenses include health insurance costs. So if they've decided to keep a Medicare supplement, you can take the Medicare supplement premium off of the patient responsibility. You have to submit that when you're doing the application so that DCF will calculate that. Dental services, hearing and vision supplies and services, if they have therapy services that are not covered by Medicaid or Medicare, then that can be added as a UMED. Over-the-counter medications and certain supplies can be submitted if that's a regular ongoing thing that can be submitted as a UMED. And nursing facility care that was not covered by Medicare under Medicare A days or Medicaid. So if someone was in a nursing facility in January and they didn't apply for Medicaid until April, then you can submit that the prior months of private pay as a UMED, and their patient responsibility to the facility will be reduced to allow them to pay the facility to cover that back bill. And when you're submitting a UMED, you need to submit that with the application or the recert or within 10 days of receiving an invoice. And a lot of times, the facilities, if someone's in a skilled nursing facility, the invoice doesn't come right away. So as soon as you can get that, then you would submit that to DCF. Just a few tips for long-term care. If you, once the person is assigned a comprehensive long-term care plan, then they are assigned a case manager. And the case manager is supposed to be going to the facility to check on them. They look through their records. They make sure that they're being, the coverage is as it should be. There's a care plan. They go review the care plan. That case manager should be in touch with either, that should be in touch with you. So get to know who that case manager is. They change a lot, so sometimes you won't hear from the case manager. You can always call the plan and find out who the case manager is for that particular person. But they are the person that can help you if you're having a problem with the facility or coverage or whatever it is. That case manager can help you, so you need to know who that is. When you're applying for HCBS, make sure that you fill out the 3008 form completely. And all of the sections that have to be filled out are have an asterisk. So if those are not filled out, we have a lot of times where the 3008 goes to the physician and those things are not filled out, it goes back to the Area Agency on Aging. They have to send it back to the physician. We've had them go back and forth 3-4 times. But if you have access to pick up the form or submit it to the doctor's office, before you leave the doctor's office, make sure anything with an asterisk is filled out. And in talking to one of the representatives from the Area Agency on Aging, sections Y and E, and I believe those are the signatures, and even something as simple like the date that has to be filled out, or it'll be rejected and has to go back and forth. And make sure there's a medication list from the physician's chart. It cannot be a handwritten note. It cannot be pictures of the bottles of the medications. It has to be from the person's chart that goes with that 3008 form that goes back to the Area Agency on Aging for HCBS. When someone is assigned to a long-term care plan, please, you'll get a handbook. If you don't get a handbook, if say the plan is Aetna, they should send a handbook in the mail. Sometimes it goes to the facility. But if you don't get a handbook, and an ID card, you should get the ID card. Again, that might go to the facility. But go online and look up the long-term care plan handbook. Everybody has them listed online. Read that so you understand what coverage they should be getting, what's covered, what's not. That's very helpful. Sometimes the case managers don't even know everything that should be covered. So it's important for you to know what's covered under the long-term care plan. If you were submitting a UMED and you're doing it on a paper application, you would fill out section G under expenses and what type of expense it is. They have the amount and if that's an ongoing expense or not. That is the paper application. Or if you're doing it online, then there are several places that you can add that, but it's all under summary of household expenses. There is out-of-pocket medical. There's additional medical, health insurance, other expenses. But on the right-hand side, you'll see, excuse me, the list there, it goes from air ambulance to the cost of nursing home, drug supplies, eyeglasses, et cetera, et cetera. So there are a lot of places that you can put the information if you have a UMED to submit. It doesn't really matter, I don't think, where you put it on the list of the household expenses. Just make sure you put it on there on the application. And then you will have to upload if you have a nursing facility bill, you'll have to upload that. If you have a healthcare premium, Medicare supplement premium that is ongoing, then you'll have to upload that premium as well. And all of those things have to be current information. It can't be from a premium statement from last year. It has to be current. And now I guess we have time for questions. So I am going to see. Oh, we have quite a few questions.
Yeah. Can you see the questions, Tracy?
I can.
Under.
All right,
Well, I can.
Sure, I'm at the
So we do have a few questions under the Q&A. I can go ahead and read those for you to answer. Diana Shields wants to know, what are the rules regarding a family keeping a ward's house? The ward's the only person alive that's on the deed. So when applying for long-term care Medicaid in assisted living or nursing home, what are the rules kind of around, indicating the ward hopes to eventually return to the house but can't anytime soon, etc.? If you could talk about that.
They're allowed to have, if that's the primary residence, that's not a countable asset unless they state intentions that they're not going to go home. That is, that's fine for them to have the house and hold on to the house if that's what the question is.
Right. And the equity maximum in a home that is not counted would be $730,000 right now. So, right. I mean, it's pretty much as long as there's intent to return, right?
Right.
Okay. So Cindy Kramer wants to know, how can we check to see if someone has a waiver without having sign-in information, to DCF?
I don't think I understand. I mean, if they have waiver, then they should, you would have to create a profile on the DCF website to see if they have any benefits.
Right. Can you call like DCF if you're a professional guardian or have some kind of legal authority and get that information?
You probably can do that, but if you are a guardian, you would have to fax them your letters, your LOG, the letters of guardianship, with the person's information, their name, their date of birth, their social security number, in order for them to be able to talk to you. Because if you're not that person, they're not just going to take your word that you're the guardian and give you information about that person.
Right. Okay. All right. Marilyn would like to know, can a person who gets $4,695 a month net, which includes pension and Social Security. Now, Marilyn, remember, income is always gross when you're comparing it against the limits. Medicaid is going by gross amounts, but somewhere around $4,700 a month, and is 65 and older. This person requires custodial care at an assisted living. Will they qualify for Medicaid or benefit from a pooled trust? So I can kind of take that answer or that question, Marilyn. So someone's making $4,700 a month, and needs, to go into an assisted living. Should they think about Medicaid? Should they think about a pooled trust? The income limit somewhere around just $2,901 a month. Okay. So if they want to get Medicaid, using a pooled trust is an option to reduce their, countable income. So the question becomes is, how much is their assisted living costing them? And does that assisted living actually accept Medicaid, the long-term care Medicaid program? So if the facility does accept Medicaid, you can count on Medicaid paying somewhere between maybe $1,300 to $1,800 a month towards the cost of care. So the evaluation is, do I have enough money in income and or assets to make, how long is my money going to last? If what Medicaid usually does in these cases is makes your money last longer. So there's all sorts of, assisted living can be very expensive. In many cases, it is helpful to get that extra payment to the facility to make your money last longer. And, putting money into the pooled trust can provide for extra care. It can make, if you're if you have guardianship fees or legal fees, any kind of fees, really, cell phone bills, we can pay that out of the trust and all that. So it's really an evaluation of how long is your money going to last? Do I need it to help, make my money last longer, basically. That's the way I look at it. And we're always happy to brainstorm with someone. All righty, so Jennifer wants to know, to clarify, if the cost of care exceeds the contracted rate of the ALF reimbursement from the MMA plan, recipient would the recipient be responsible for the difference in addition to the room and board cost? Did you get that, Tracy? So basically it's about the cost of care. So if I believe the answer to this is yes. So if the contracted rate with the ALF is $7,000 and Medicaid's only going to pay, $2,000 or what, or the contract, a certain amount, you have to come up with a difference. Is that right?
Yeah, the patient is responsible for anything above what the long-term care plan is covering.
Okay, so I'm looking at this question a little bit more in more detail. They're saying that the cost of care is even more than what Medicaid is paying to the facility. So they still have to pay that additional cost of care, right?
That should be, the assistive care should be covered by the long-term care plan. I would check into why it is not covered, but anything beyond what the long-term care plan is paying is up to the patient to cover.
Okay. All righty. So Marilyn wants to know, is PPO, not HMO type plan available with Medicaid? She thinks not. So, are there PPO plans? I'm not sure if you're talking about like the managed care plans or if you're talking about a dual eligible type plan, Marilyn.
I know that the LTC or the MMA plans are not designated as HMO or PPO.
Okay.
But if they have a dual eligible Medicare Advantage plan, that could be an HMO or PPO. But
Okay.
I think it depends on the individual private plans like Aetna, Humana, as to what plans they offer.
Right. Yep. That's my experience also. Marilyn made a comment here in the Q&A. If applying for Medicaid, start with the Florida Agency on Aging or myaccess.myfamilies.com. Yes, that's absolutely right. You can Google, and I think we had the resource in our slides also. Your area agency on aging is where you start the waitlist process. And the myaccess.myfamilies.com is the actual application to DCF for the financial qualification. So,
Right, but again, you cannot apply for HCBS if you have not been released from the wait list. You will be denied.
right. Now, we do a lot of medical Medicaid, like QMB for families or people that are on the wait list. And so sometimes you can get medical Medicaid while you're still on the wait list. And that helps to reduce your out-of-pocket costs. Let's say you're in assisted living or living at home, and make your money last longer too while you're on the wait list. Can you apply for UMed credits at any time or only when applying for Medicaid long-term care?
UMed is only for people that are in a skilled nursing facility.
Okay. Only skilled nursing. All right.
Again, the UMed only reduces the patient responsibility to the facility. So that only applies for if somebody's in a nursing home.
Right. And Tracy, I wanted to ask you something to make sure on the UMed, if somebody has already paid an expense that would qualify under the 3-month rule and all that, can they submit that as a UMed?
Yes.
Yeah. Okay. All right. Is there a lag time between contacting the AAA and getting the phone call for the interview?
Yes. Depends on where you are in Florida and how backed up they are. I know one of the most recent ones, someone made a phone call and it was 3 weeks before they got the initial call to set up the initial assessment to get on the wait list. So all of that takes time. It's not real quick. You can call and they'll call you right back.
Right. Catherine says, if someone is QMB and not QMB plus with the MMA, does the same situation apply with Medicaid?
I saw that and I'm not sure what they're referring to. Catherine's referring to.
So that QMB and QMB plus can be actually very confusing. It's hard to say exactly if there's additional benefits with QMB plus. I think maybe sometimes there can be maybe lower cost. Is that right? I mean,
with QMB, QMB stands for Qualified Medicare Beneficiary, folks. And so that person, you have to have Medicare to have QMB. And if Medicare does not cover it, Medicaid will not cover it with QMB. Medicare covers a majority of things, but if they don't cover the service, then Medicaid will not cover it. If somebody has QMB plus and QMB plus is not available in all areas of Florida, they would have to have, it's basically QMB, Medicaid, and full Medicaid. So the difference with that is that full Medicaid would cover any bill. But from my understanding, in order to have QMB and full Medicaid, the person has to live in an institution, live in an ALF, and have QMB and be below the full Medicaid income limit.
right.
In order to qualify for full Medicaid, you have to be in an institution and have be below the Meds AD is what they call it, the full Medicaid income limit.
Yeah, which right now I'm looking at the chart is $1,149. So it's lower than the normal QMB rate of $1,305. It's yeah. All right, thank you. Can you set up a trust if the client is on Medicaid, Medicare, and Med waiver? Age 42, the trust would be saving a little bit of money each month. One of the rules around using a pooled trust is that you have to meet the definition of being disabled. If you're 42, as long as you're on Social Security disability or, SSI, the answer is yes, you can set up a trust. So, for the age 42, and it sounds like they probably are because they've got the Medicaid, as long as it's not like family Medicaid, it doesn't sound like it is. Then yes, you can set up the trust. Did you cover the use of QSIs on Jerome? I don't know what a QSI is. QS1? No. I don't know what that is. Do you, Tracy?
I don't see that question. No, I don't know what that is.
Sorry about that. Why is a pooled trust for over income person going to ALF and not QIT? Okay. So when you're going into an assisted living, and if you're just over the income limit, you can potentially, you have to check with your attorney as what's covered at what you can pay for out of a QIT. Because you're limited to, generally medical expenses and personal needs allowance, that kind of thing. So, a pooled trust is not limited in what you can pay other than as long as it's for the sole benefit of the individual. The QIT has certain limitations on what you can and cannot pay out of it. So pooled trust works definitely better if someone's at home on the waiver program. If they're going into ALF, sometimes the QIT will work, sometimes the pooled trust is better. It really just depends, on the situation. So I would double check with your attorney there. Chanel wants to know, can you clarify what can be paid? Cell phone bill, guardianship fees. I assume that's meaning out of a trust. Yeah, it's sole benefit rules out of it. Oh, it's 12 o'clock. So we got a sole benefit rules out of a pooled trust. Okay, I'm going to take two more questions here, and then we'll wrap it up. Are HOA fees, like life insurance premium, house repair, permitted to be paid out of a special needs trust for a long term? Okay, that's kind of a loaded question. Give us a call, and very often the home expenses can be paid for out of the trust, but we have to evaluate the situation. Okay. So great questions here. I thank you so much for joining our presentation. You can reach Tracy. Did you want to make a comment?
Yeah, I just wanted to say I see some questions that we didn't get to. You can send me a question at benefits@trustaged.org or Tracy, TRACI, at trustaged.org, and I will be happy to answer whatever questions I can answer for you.
Thank you so much, Tracy. And our website also has contact information on it. And join us next month in November on the second Wednesday for a presentation by John Finch on ABLE accounts. There's some new things coming for ABLE, and it'd be a good refresher for you also. So we hope to see you on November 12th. Thank you so much for joining us today. Bye-bye.